Hey, everybody, welcome to episode 435 of our Tick Bootcamp podcast. We're here today with a very special guest, Dr. Eboni Cornish from the Amen Clinic, who's a specialist not only in chronic Lyme disease, but all things chronic health from Lyme disease, mold, brain health, Morgellons. And her goal is to take a holistic approach to rebuild health from the whole body standpoint, not just a singular micro targeted standpoint. And I'm here today with my really good friend, Jenny Buttaccio, who's going to jump in shortly to really geek out with some really targeted questions that were given to us by followers on social media and questions we've created from researching Dr. Cornish. But before we get into those, Dr. Cornish, I want to ask you, how the heck did you ever get into the world of chronic Lyme disease in such a controversial world to help our desperately needing community in the chronic Lyme community?
You know what? It was not intentional. Okay. I went to a job opportunity in all places, Craigslist. This was like 12 years ago. And the job said for doctors who think outside the box. And I was so bored working Kaiser, doing all that kind of 9 to 5 family practice. I was like, why not? Had no idea how outside the box I would be now 12 years later. And it was at that time that I heard about kind of functional medicine, but more importantly about chronic Lyme disease, because I got trained in thinking a dose of doxycycline was all you needed to get better. And I was living in DC. I'm originally from Detroit. So the first time I had encountered Lyme disease was when I was in med school at Brown in Rhode Island. And I'll never forget it. It was this guy, he was a landscaper, had a tick bite. He got his doxycycline 1 dose, and then he came back the next week saying he was still sick. And so my attending at that time gave him another 1 dose, right? And then after that, he was still ill. And so I'll never forget this. My attending said he is drug seeking. He can no longer have antibiotics. And I didn't think anything about it until I landed into my first job in chronic Lyme disease. And from there, it was like I couldn't turn back practicing that type of medicine. And it evolved to do all the things you said. But more importantly, I consider myself a detective because I look for the root cause of all diseases in a person, just why they're not better. And by the time they come to my doorstep, they've seen 5 or 6 other doctors and are really looking for that missing piece. So it was kind of like by desire to change, by need for what patients need as far as detective work and not being dismissed out of offices. And then I'm a researcher at heart. I work at NIH. I love research. And so that was the next part. That was like the cherry on top when I was like, Lyme is new, discovered, and people are researching it. So, hey, and now I'm here today.
But I mean, you are being a little humble right now because, just from doing a Google search for you, Dr. Cornish, we can find that you were honored as Northern Virginia's top doctor for family practice in both 2021 and 2022. You were also recognized by the Continental Who's Who as an exceptional woman in healthcare. And then you also did some really cool things. Like, as you mentioned, you were a researcher at the National Human Genome Research Institute at the NIH, right? I mean, these are really cool, high level, like genius level things that you have done. So, I mean, I want our listeners to know how brilliant you are and how lucky we are to have you fighting for us and helping our community. So, first of all, thank you. And now if we could just jump into some questions, and I really want to help the community listening because I think there's a ton of value here that you're going to be able to help everybody listening who's so desperate for help in the Lyme community.
Okay. Sure.
Jenny, you're up.
Yeah, woohoo! I'm excited, Dr. Cornish. So, like Matt said, I'm Jenny Buttaccio. I have worked with Matt on multiple different podcast episodes before. I also have had Lyme, but I'm doing well, and I'm always looking for ways to help educate patients on how they can get better, and just help give tips and tricks, and the same kind of philosophy that Matt has, looking for ways to give back. And when I posted a story in Instagram, asking people to submit questions for you, I got a lot. I'm not gonna lie, I got a lot. And yeah, well, it's good. Sometimes Matt and I have a format that we try to follow, but we're going to throw caution to the wind, and we're going to do almost like a Q&A kind of style just with you today, because we want to tap into that wealth of knowledge and just, learn about you and your background and the discoveries you've made along the way. So I have several questions. They're not really in any particular order. So if it's like a little bit of a ping pong question and answer, That's just kind of like what rolled in my DMs. Okay, are you ready?
I'm strapped in and I'm ready to go.
Okay. So the first question I got was in regards to your expertise in neurological Lyme. Someone asked me, with all the work that you're doing in brain health, are you seeing any actual physiological changes in the brains of people who have Lyme?
Yes, I definitely am. So the reason I actually joined with Amen Clinic and merged my private practice with Amen Clinics over 9 years ago now was because of that neuropsychiatric manifestation of tick-borne disease. And also the fact that I wanted to learn how to read brain imaging because I think SPECT scan imaging is so awesome. It looks at deep rooted problems. It can look at anatomy, at blood flow, and activity of the brain. And when we think about neurological manifestations of Lyme, you always want to look, right? Because so many Lyme patients will go get MRIs and CT scans and they're completely normal. Unlike when I'm looking at SPECT scan brain imaging, which is a special form of brain imaging, I can find patterns that I see among patients who we think have what we call toxicity. So I can look and say, hey, there are areas where that person may not be getting as much blood flow as they need. Or there are areas where, like the cerebellum, which is in the posterior part of our brain, is not as active. So that means that executive functioning is going to be off. I also see patients who have chronic infections that might have anatomical changes with what's called their temporal lobe, which is the part of the brain that we use for language, for memory, and it would make total sense. And also in the front of the brain, which is called the frontal lobe, they may have decreases in blood flow there. And that's like the CEO of the brain. That is like the powerhouse. That's the boss. So if you can think about it, if you start having anatomical changes caused by inflammation and infections in specific areas of the brain, then you can try to develop different targeted skills as well as differential diagnoses for those patients. I also have a lot of patients who can have decreased activity diffusely on their brain scan, and we call that something called hypoperfusion. That means it's just decreased blood flow throughout the brain itself. And that's very exciting because we have things like hyperbaric oxygen or certain antibiotics that might cross the blood-brain barrier, as well as herbals that can improve blood flow. Things like fibrinolytics, like, Baluch, lumbrokinase, also protein, things like serrapeptase, and then those antibiotics that will get that blood going in hyperbaric oxygen. So yes, there are definitely patterns that I see both on brain imaging, but also symptomatic. I'll see patterns, people who have neurological or late stage Lyme disease, chronic Lyme disease, they may present, and we call it the great imitator, with symptoms consistent with maybe Parkinson's features or multiple sclerosis like features or dementia, Alzheimer's, depression, and because that's why we call it the great imitator, and not to mention the neuropsychiatric component. So absolutely. And that's why I treat neurological Lyme intensively because of that problem.
That's really eye-opening to hear that information, from somebody who's actually looking at the brain. Because I know a lot of patients wonder that. And you mentioned the SPECT scan. It's SPECT, right?
Yes,
SPECT.
SPECT. Yep, SPECT.
If a patient wanted to have one of those done, where would they go? Or is there a certain doctor that they would see that they might be able to get that?
Okay, so just so people know, SPECT scan, and that stands for single photon emissions computer tomography. So it looks like a CT scan or MRI, but it's a nuclear image test that actually use like this radioactive tracer, and it looks at 3D images of the brain. So we're looking at how the brain blood flow, oxygenation, and activity. So it tells you what's working not well enough, too well, but more importantly, if something else is going on. Like I've had people who've had brain imaging and we thought, oh, it's neurological Lyme. but it might be frontal temporal dementia, like what Bruce Willis has, or a really bad traumatic brain injury. So those are things that we do at Amen Clinics. amenclinics.com is our website, because Dr. Amen has this paradigm whereby he can look at brain scans and determine if there are neuropsychiatric issues associated with certain patterns, if there's that pattern, as I alluded to earlier, called toxicity, or if it's traumatic brain injury. And when it falls under kind of that toxicity realm, that's where I come in. That's where they would always send me all the abnormal SPECT scans and say, hey, what's the root cause of this? And even in my program, at Amen Clinic, we have a 2-week, what's called the neuroinflammatory intensive outpatient program, where people have been traveling internationally. They come for 2 weeks, they get their SPECT scan so that we can tell on the brain what's happening actually from neurological impact from Lyme. I read the scan, I give them their report, and we also develop a very intensive 2-week protocol that might include IVs, herbals, hyperbarics if needed, you name it, to help get that brain optimized. Because you're really not born, you're born with a brain, but that's not it. The brain can heal if it's damaged. And that's why it's so important that with especially patients who have chronic illnesses, that it's evaluated, because you might be missing something else that vector-borne diseases are making worse in your body. And you may also be able to tailor your treatment approach based on what findings you do have.
That's such a hopeful concept, though, that the brain, can heal, and that, as you go through life, it can change, but it can change for the better. It doesn't always have to be like a bad thing as a result of Lyme and co-infections, but that the health of your brain can improve. I mean, that's
exactly.
Yeah, for people listening, that's very encouraging, a very encouraging message. You mentioned toxicity, and I got a question about that. Now, I'm not sure if this is specifically what you meant, but we're going to see. It was, what types of common environmental toxins are you seeing in people with Lyme, or even just chronic illness in general? Is there sort of a general theme of these toxicities, specifically environmental toxins that you're finding in people who have chronic Lyme?
I would say number one on the list is definitely biotoxin illness from the environment, like mold and mycotoxin illness. I think that is so commonly missed, and people who are exposed to water damaged buildings, some people go into those water damaged buildings, Jenny, and they are fine. They are absolutely fine. They could be the mustiest of buildings, like mold pits, as I like to call it, whereas someone else, based on their genetics, they may go into that same environment and are ill for years. Because the scariest part of all is that those mold toxins can circulate indefinitely in the human host and impact so many different areas. Like, I do talks all the time about neuropsychiatric manifestations of mold. These are patients who present with toxicity and someone's diagnosed them with mood problems, but it's mold. In my Lyme patients, it's so critical that I evaluate their environment, even if it's just as simple as a questionnaire, because I find it's very challenging, and in some cases downright difficult, and some doctors may even say impossible. I don't believe that, but I've heard that, to treat someone with chronic infections in a water damaged building, in a mycotoxic environment. So I think having that is key. And I always tell my patients when they're starting with me, I say, look, there are two things, no matter what disease you have, that you can control during this process. It's where you live and what you eat. That's it. Everything else is treatment. So if I'm treating a Lyme patient and they're living in a water damaged building, or they have circulating mold toxins in their body, they might as well live in a tick nest. It's the same kind of analogy. Like, you're going to be breathing in this toxin that's causing more inflammation that will then lead to replication of these infections, because they love a hostile environment. When it's inflammation, it is party time for not only vector-borne diseases, but most infections in general. So I would say that's number one. The second common toxicity that I see is heavy metals, and specifically mercury toxicity. And we know that with mercury and arsenic, they are two heavy metals that compromise. They are two metals that compose the biofilm. And the biofilm is what is like a protective layer around some of these vector-borne illnesses, especially Borrelia burgdorferi. It kind of becomes resistant and keeps itself protected in this biofilm, as well as the other organisms as well. But when metals are present, it makes those infections more resistant, because it's very hard for antimicrobials like antibiotics or herbals to penetrate through that biofilm barrier. And on top of that, I have a lot of patients who have vector-borne diseases and have very poor dental hygiene. And so they usually have their mouth full of metal amalgams or fillings that are full of foreign dental material. And I would say that's the third one, is the foreign dental material and byproducts that I see in my patients. So I'm always looking at the mouth. I'm always doing, dental gum testing. I'm always inquiring about their history, because you'd be so surprised how many patients with vector-borne diseases, because their immune system is already compromised, are more susceptible to dental infections and gum infections. So I'm starting to think that oral microbiome is a contributing factor that we don't talk a lot about as it relates to persistent neurological tick-borne diseases.
I'm going to ask a quick question on that one, because I know myself, I do a lot of things periodically to help detox, whether it be heavy metals or mold or just, in general. But if people know they're suffering from mycotoxin illness, right, mold exposure or heavy metals, or they just want to do things to help aid in detox, not only these two really important biotoxins, but just like a general sort of routine that they can do periodically to improve their health, what do you do with your patients to help them detox these environmental and biotoxins that they've been exposed to?
Well, I make it simple. I have a simple protocol, and then I bring it up very gradually, because one thing everyone wants to do is give a binder, charcoal, clay, glutathione, infusions, vitamin C, Myers cocktail, Tutica for the liver, and the list goes on and on. But before I go to that, I make sure I have the fundamentals of detoxification on board. And that's the microbiome. Because if you're constipated, or you have irritable bowel, or you have leaky gut, or your gut is destroyed, then how are you going to really absorb well not only the medications we're taking or to treat the toxins, but those detoxification agents that you're taking to help clear you? And more importantly, if you're constipated, you're like a septic tank. So all the things we're trying to clear are just backed up. And then, especially with mold illness, our number one detox oral agent are clays, binders, things that help attach to mold. Well, if you're trying to pull these toxins out and they're stuck in your colon, then you eventually reabsorb them. So I make sure I have a steady foundation, both from diet toxins, that you're not ingesting them on your own, gut regulation, and then I start layering on some of the other important strategies. I love detox, easy ways, castor oil packs. Castor oil is great. I love doing Epsom salt baths with baking soda. Infrared sauna is changed my practice and my personal life dramatically. And then we start thinking about the things you take. And that's where I layer on things like the charcoal or the zeolite, bentonite clay, chlorella, glutathione, NAC, Tutica, liver support, but it does depend on what I'm treating. But I'm telling you, once I get those foundations, the right lifestyle and diet, the gut support, and then doing the non-oral forms of detox in place, that's the easy, free stuff. Then I can go ahead and layer on some of the supplementations and treatment, and I find that they're more effective.
I appreciate that on that list are very economical options like Epsom salts that, you know, that's very readily available for the average person. I know like the concept of detox can sound sometimes so expensive, you know, and like unattainable for people. But I mean, you gave 3 things that were all within, you know, like a lot of patients' budgets. So that's
And
amazing.
Alka-Seltzer Gold is another
Yeah,
one.
yeah.
Cheap, easy, over the counter, works magical. I mean, you have to, because it all ends up being expensive, right? Like you said. And one of my patients said, being sick is expensive, but you don't want to just keep piling on the cost with supplements and medications that you may not necessarily absorb. So that's why I preach so much about the microbiome. And I'll tell patients, you have 30, 40 supplements, 50 pills a day. Let's do a nutritional test and see if you're even absorbing this, or a gut test to make sure your gut's not leaky. 9 times out of 10, that person who has that pharmacy full of supplements and meds and still not getting better, when I do those tests, they have malabsorption. They have leaky gut. They have things that are naturally preventing them from gaining optimal absorption and benefits from those treatments. So that's why I say just as much orally as I recommend, I give the easy breezy lifestyle and other detox methods we just discussed, because you're right, it can be overwhelming. So number 1, don't ingest those toxins. Don't make yourself toxic by doing the toxic foods. You know, let's try to prioritize. And I tell patients that all the time. Try to prioritize.
Yeah, and what you going back to what you said earlier, control the 1 to 2 things you can control, and the food is definitely one of those.
It is. It is.
I want to stick on the topic of detoxification for a second. I know Matt and I have interviewed some previous physicians that didn't really feel methylation in particular was such a huge part of healing for people, but there's other physicians who feel like it's a really big piece of the puzzle. What are your thoughts on methylation, and how much does that contribute to somebody's ability to heal, or maybe inability?
I think it's important. I think, you know, being that I did spend time in the 90s on the genome project at NIH, genetics is very important to me. But I also know what's even more important is epigenetics. And epigenetics is how your environment makes those genetic mutations more active, or what causes the problems. I'll never forget, I heard a doctor say once, genetics is the gun and epigenetics pulls the trigger. I love that phrase because it's so important to understand that, because I have patients who come to my office with genetic reports, 23andMe, methylation panels, and the like. And MTHFR specifically, because that's the one people talk about the most, MTHFR or CBS mutations or glutathione problems, intolerability, sulfite or sulfa derivative sensitivities. I always say, okay, look, yes, you have this mutation. It may cause a problem with you detoxing. We want to make sure, more importantly, that you're not taking things that are harmful based on this mutation. So for example, with MTHFR, making sure they're not taking folic acid or the wrong type of B12, things that may harm them. And at the same time, if they're having, because we all have genetic risk factors for numerous things. And MTHFR, if you look at biochemistry and that whole methylation pathway, it's like one small dot on this huge pathway that, as it relates to, you know, detoxification, right? So I do think that optimal detox support is critical, but I don't think that people should have that doom and gloom like I see so many times in my office about having the MTHFR mutation. I mean, it's like people come in like, I have this, I'll never get better. That's not the case. Just remember that we have genes, we have genetic mutations, but we have to better understand what makes those genetic mutations act wrong, as my grandmother would say. What makes them go haywire? And if you work on that and you help the body detox, then I think your treatment will be more tolerable, and it may not be as long of a clinical course. But I don't like when people just get so consumed and that's it with the MTHFR gene alone.
Yeah, you're presenting such a practical, down-to-earth view of methylation in particular, but sort of all these healing steps. I mean, like I could imagine as a new patient in your office where this is really overwhelming, I think I would feel more at ease. like, hey, there's actually like a step-by-step plan here that we can follow. And we don't just have to throw spaghetti at the wall and see what the heck sticks. Like, I like this, yeah, down-to-earth approach.
Yeah, and I mean, it wasn't something, I developed overnight, right? I mean, I've been treating Lyme since 2010, 2011. And like I said, even from day one, and before I became treasurer of ILADS and on International Lyme Associated Disease Society board and getting really involved in the organization, my person I worked with at that time was already a member and was already seeing challenging patients who had chronic tick-borne disease, even from birth, from gestation. And so it's overwhelming. And at first I would be that doctor. And sometimes some people might listen and say, maybe she still is, but would give all the treatment, all the drugs, all this upfront. Let's start this today. Then I realized, okay, if I'm going to eliminate this problem, I need to first understand what makes that patient so unique and so special, so that I'm not thinking about it as sick and healthy. I'm not thinking about it like that. I'm thinking about it like, okay, this is a patient who's suffering from a chronic, debilitating stealth organism, by which there are probably other factors and imbalances that are compromising their immune system simultaneously. What do I do about it? How do I put that puzzle piece together? And I found over time that if I just look at the basics, because you want to say what makes someone special, well, the infections alone are very serious, but we know Lyme has been around since the caveman, and we do not want to belittle how severe these tick-borne diseases are and how much, how many problems it can cause, because they are very complex and very, very serious and devastating to a person's life. But at the same time, if you don't look at the basics, like the gut, like someone sleeping, like their hormones, like their detox, then what are you doing? And I tell patients that all the time. I tell them, just like I told you, there are two things you can control. I'm telling them, look, there are two things I must do. I need to make sure you're sleeping, and I must make sure you're pooping, 1 and 2, so that when we get started and while we're treating this infection, things work better. And I just found that over time, because the patients I've seen have all been treated or started either by themselves or other doctors, that it's time to take a step back and reevaluate and not just have a cookie cutter approach to each person with vector-borne diseases like so many people do.
Dr. Cornish, I want to go a little bit deeper on this topic with you because I watched all of your videos, and I have to tell everybody I was fascinated by them and I learned so much. And one of the things you talked about was detoxification in depth in one of your videos. And to me, this is a really important concept because essentially detoxing is removing toxins from our body, but that's twofold. We have to remove toxins like the biotoxins you described, mold, mycotoxins, also heavy metals. So that's detoxing out those bad things from our body, those toxins from our body. But as we start to treat the stealth microbes like Lyme disease, and we have die-off, we have to remove the die-off, which is a toxin as well. And if we don't have good detoxification, we're going to feel worse as we treat. And some people might actually get worse and have some damage. And we've seen that on this podcast. So you talk about detoxification in great detail, and you specifically speak about mental and physical detoxification tools. And I want to get to that next. But first, I'd like you to speak about the liver detoxification pathways and supportive nutrients, because you go into phase 1 and phase 2, which ties into everything you're speaking about. And people have good intentions. Doctors have good intentions sometimes, and they don't address phase 1 and phase 2 detoxification. And they could be just recirculating toxins and making their patients worse. So can you speak to that, please, Dr. Cornish?
It is so simple. So let's break it down. So in the first step of detox, right, we have all these little enzymes. Everything that we eat, breathe, smell, think about is toxic. I mean, our society right now is more toxic than ever before, and we all know that. So we cannot hide from these toxins. So as a result, our body is so beautifully designed that we have specific enzymes called CYP450 enzymes, and they are specifically coded for whatever toxin that enters you to go and attack it and break it down. So you have these enzymes that are going around like Pac-Man, breaking these toxins down into smaller particles, which is good. But toxins start as fat. So you can't throw fat down the drain. And in our liver, those enzymes break down those fat toxins smaller so that they can then convert over to water so that you can poop and pee it out. And those are processes like sulfation or glutathione, which is something we make in our liver, conjugation. And you need certain vitamins and nutrients, not just supplemental, because people get so consumed just with taking things. That's the cheat way. Get it from your foods too. Get it naturally. Try to incorporate things that have those same ingredients. Like even with glutathione, that's cruciferous vegetables. If you're not sensitive, eat greens, eat cruciferous vegetables.
Can you give us some examples, Dr. Cornish? What foods and what vegetables will aid in detoxification that are free, healthy ways that our listeners can start adopting in their diet?
There you go. So things like kale and spinach, and my favorite, Brussels sprouts and cauliflower. You know, those are just the top 4 easy things. And go to your farmer's market and look those up, you know, right? Beets can also be helpful, but you got to be careful if you have glucose issues. Just like with spinach, you got to be careful if you have mast cell problems, right? Even things like apples, and bananas, because they are like prebiotic rich foods that also help with gut detox. So those are like easy breezy, the top foods I have all my patients incorporate to help detox in the body. Lemon in your first glass of water in the morning, boom, 25-cent detox. Get your lemon, squeeze it in your water, get out your day in the morning, and that starts opening up that liver pathway, clearing things. Because what you don't want to do is break these toxins down, you know, using supplementation and the like, or foods, or whatever you might use, and then have it blocked. And that's what that step 2, that phase 2 of detox. That's when you got to poop and pee things out. But when it crosses over, what I find a lot of times, even if you have methylation problems, or you have what's called sulfation problems and other issues, those toxins can't get cleared. Or if you have constipation. So now you have all these toxins that have been broken down, that are freely circulating with the hope that they'll get cleared out the body, and they don't, and they get reabsorbed. And then they just keep that vicious cycle going. So I've found that incorporating dietary strategies and healing the microbiome, as well as, if needed, the things I mentioned earlier, like the baths and the saunas, you know, and the foods and detox drinks like green smoothies are also great if you can tolerate them, can really help. You really help. And then you can layer on supplements as needed.
I don't know about you, Matt, but I will be having some broccoli for dinner tonight.
There you go. And some Brussels sprouts too.
Oh, I'm always on board with Brussels sprouts. Yes, yes. In the intro, we mentioned how you treat Morgellons patients, and that is such a rarity. And we've talked with patients who are dealing with that, and it's just such a challenge. So I want to ask you a few questions about that. Number one, have you found a link between certain infections and Morgellons?
So the research that we have by my wonderful mentor, Junior Staveley, who wrote with Raphael Stricker years ago, they found Borrelia was associated with Morgellons. It was first diagnosed in cows, bovine digital dermatitis. And that's when they found that spirochete was found in the hooves of cows that had these fibers growing. Okay. Now fast forward to where we are now, and I call Morgellons the mold and mast cell. I call it M&Ms, right? Because usually most of my Morgellons patients do have some sort of mold or yeast issue. All right, some environmental toxin, either due to mold or yeast. I also see Borrelia. Specifically, they published on relapsing fever Borrelia being associated with Morgellons, okay? And anecdotal, so this is not published, but what I see a lot in my practice, I also see patients who have Bartonella. And it's so interesting because before I knew what Morgellons was, I was treating it. And I had a patient of mine who had these lesions on her legs. Now, she was told me later, after treating her for 3 years, and I finally found out about Morgellons, that she was embarrassed to tell me that she was seeing fibers and strands coming from these non-healing ulcerations on her legs. But at the same time, once I treated her Lyme disease, her lesions went away. And she was on a multiple antibiotic protocol for Borrelia and for Bartonella. So we were using, a really comprehensive plan to get to the, central nervous system and with antibiotics. And every time she went off antibiotics, her lesions would come back again. And I didn't put two and two together until I learned what Morgellons was. And then I also learned what mold was and tested her for mold. And sure enough, she was living in a water damaged building. And then with Morgellons, I don't think it's different from vector-borne diseases. I don't treat it differently. I feel like it's a dermatologic manifestation of someone who has severe chronic vector-borne diseases. And this collagen and these fibers that are produced when the person has the right treatment for tick-borne diseases, they get better. So it does take longer in a lot of cases because you have to also, like I said earlier, figure out what makes a person so unique, because why doesn't everyone with vector-borne diseases have Morgellons presentation? So that's where the detective work comes in. And as I alluded to, you think of environment or other toxins that person might be exposed to that is already creating some sort of barriers or just hindering their immune system so that when they get this insult of vector-borne diseases, they're more likely to have such a severe and prolonged presentation, like you see in debilitating in some cases. But I do find great joy in treating these patients because once you get the root cause, the symptoms get better. Now, they go down a longer road. And a lot of my Morgellons patients are on, comprehensive Lyme protocols for a very long time. So, but you need to know the root cause.
I have a part 2 on the Morgellons question. Besides the dermatological manifestations, what other symptoms are you seeing those patients have? I know the list is long, but from your perspective, what are you encountering?
Yeah, so I see the same thing I would see with patients with vector-borne diseases. So for example, if I have a patient who has Morgellons and also has Bartonella, they may complain of pains on the soles of their feet, numbness, tingling, brain fog. They may, on top of having those non-healing ulcers, may have something called striae, which are stretch marks. If I have someone who has anyone in the Borrelia family, they may present with joint pain, headache, chronic fatigue, and it can overlap with other symptoms. If I have a Morgellons patient who has babesiosis, they're going to present with symptoms, maybe dysautonomia or inappropriate changes in blood pressures from lying to standing, sweating, definitely profusely in night sweats, brain fog, and headache. And the list goes on and on. So it's not just like with these diseases, there's no cookie cutter. And I would think what makes Morgellons unique is the fact that they have these non-healing ulcers, of which I see because I do electronic microscopy. So I'm looking under 100x under the microscope to actually see these collagen filaments under their skin in order for me to justify a diagnosis of Morgellons. And it's important to do so because it's given such a bad rap, such a bad rap. I have so many patients crying or coming to the office and they've been misdiagnosed as delusions of parasitosis or just really bipolar and manic. And once I see and I can confirm that diagnosis by doing my data testing for infections and also skin examinations, and I'm like, bingo, there's truth here. That's when it really is exciting and rewarding.
That's going to be so helpful for those who have Morgellons that listen to this or think they do. I know, because yeah, like you said, it's a group of people who have just been dismissed repeatedly, doctor after doctor after doctor. So to know that there's doctors who are putting all the pieces together, they're looking for the lesions, they're taking into account all the symptoms that they might be experiencing. I mean, that's just, it's incredibly helpful
Oh,
for those people.
Thank you. You have to do it. You have
Yeah.
to.
Yeah. Yeah, that's really good information. I'm so happy we got to ask some questions about that. Yay.
Hey, Jenny, real quick, before you go into the next one, I do want to just ask, because we're talking about mold, multiple infections, we're talking about Morgellons and mast cell activation. One of the things I remember hearing you mention, Dr. Cornish, in one of your interviews was multiple initiators of the cell danger response, which are, bacteria, parasites, viral yeast, things like that, mold illness, mast cell activation, heavy metals, all that stuff, and they all trigger cell danger response. But that triggered for me to ask you, that term is very specific, and we've heard it before with Dr. Kathleen King from Primal Trust. Is there any kind of overlap there? And if not, can you tell us your definition of cell danger response and how that plays into all of these potential, M&M models that you described?
So here's kind of how I break down cell danger response just generally so anyone can understand it. All right. And it's relevant right now because it's hurricane season. All right. So this is my analogy. So your mitochondria is the energy, gives you energy, gives you power. And whenever there's a threat to your cells, may that be a virus, Lyme disease, any kind of threat, there is actually a change in electric voltage in your cell, okay, that occurs. And that's why some people do energy testing and the like, but there's a change in electric voltage. And your mitochondria, it's in that change sends a clue that, hey, we're under attack. There's something here. So as a protective mechanism, the mitochondria sends signals out that says, okay, look, it's time for us to kind of slow things down a bit because there are threats in the midst. And if we keep replicating and we give this threat an active mitochondria to use for their benefit, you're in trouble. So that's kind of one of the reasons why when you're sick or you're ill, that's one of the first things that happens is you become tired and exhausted. Over years, depending on how many insults, and with my patients, there's so many. And that's where I go back to that kind of analogy of a hurricane. So when the mitochondria step in and they're like, okay, look, threats are here. Let's go seek refuge. Imagine that as being a basement, okay? So it's a hurricane, there are threats. I'm gonna run in the basement and hide, okay? So stop, cell danger response. Then it comes up those stairs to see if the coast is clear. Let's say it's 100 flights. Peek their head out the window, mitochondria, and it's still a hurricane. So what happens? You got to run back down the basement. Then you're going to try again. It's still going to be a hurricane. And it gets to the point where with the cell danger response, that mitochondria is just wiped out. It's exhausted. It doesn't really want to put that effort or that goal of healing in play because it realizes there are still so many threats in the midst. So what's the point? Why am I going to run up 100 flights of stairs if it's still a hurricane? I'm going to have to run back down. And the problem is that even when it's sunny, the rain clears, it stops, you can survive outside because it might be sprinkling. The body kind of is over it. It's like, never mind. I'm not even going to try. I don't even feel like it. And that's the kind of patients I deal with. That's kind of my Cornish breakdown, cell danger response. You've probably never heard of it before, but it makes sense to me.
It is amazing, Dr. Cornish. I love the analogies that you use because you take complex topics and make them easy to understand, right?
Yes.
And I do want to ask you one follow-up to that because beautifully said, and I understand completely. But I do think there's a component to that I've heard you speak on as well. And I want you to just go a little bit deeper here if you can, because those are both real and perceived threats to the cell. So real threats being active Borrelia, viruses, bacteria, mycotoxins, heavy metals, all the things you're talking about. But also you talk about neuroplasticity and how our brains get wired and stuck and they perceive a threat even after it's gone, and how that can invoke the cell danger response as well and keep us sick, even if the threat might be eliminated potentially. So can you speak about that, Dr. Cornish?
Yeah, and that's that same analogy, right? So what happens is after such a long period of time of having these threats in the body, it's just part of the brain called the limbic system. And that includes basal ganglia, thalamus, and I actually can see that on brain scan imaging as well when I'm looking at SPECT scans. And a lot of times that will be overactive. So that means, ooh, it's just heightened. That person is in fight or flight. That limbic system needs rewiring. I might recommend things like DNRS, like you mentioned earlier, Primal Trust, Gupta program, or something that can calm that limbic system down so that the person can start healing. And that's the analogy I use about the basement. Like, even when it's not raining anymore, the body is in such this limbic system overdrive that it can't see that. It just feels as if it needs to remain stuck. So a lot of my patients go through that. And that other thing that you'll see clinically with patients who have this limbic system issue, they don't tolerate things. They have really bad histamine responses. They have really bad limbic system responses. And I'll never forget, Matt, my first patient who I found had this fight or flight limbic system problem. I tried to give her like a drop of an herbal, and she went to the ER. And I'm like, what is this? What kind of field am I in? I quit. But then, sure enough, years later, I looked at her brain scan. Well, sorry, months later, and I looked at her brain scan. I saw that basal ganglia and that thalamus was on fire. She had a ring of fire.
So wait, you can actually use the SPECT scan to determine if somebody's stuck in fight or flight?
Oh, God, yeah. That's the beauty of it. You can look at this special image and you can look at those areas of the brain, like the anterior cingulate, the basal ganglia, and the deep limbic structures like thalamus to see if they're called hyperactive or in overdrive. The psychiatrists use it to, extrapolate like if there's anxiety or trauma or, ADD or ADHD, attention focus problems. When I look at it, I use their terminology. I kind of understand what they're saying, but I take it a step further and I say, but wait, nonetheless, these structures are in overdrive, so this brain is not going to calm down. And if your limbic system is on fire, okay, I always say lit up like a Christmas tree because that's what it looks like. It's like hyperactive. Then you're going to be stuck in that fight or flight. And that's usually my patients. Before I've met them, I've looked at their scan. And when I see that limbic system, I'm like, yeah, this person is going to have probably some autonomic dysfunction. They're probably going to have some sleep problems. They might have, some neuropathy. A lot of times they have mast cells. So there's already a differential diagnosis that I have just by seeing visually how the limbic system, if it's active or not. And that's beautiful because if people get scans later, I do a lot of before and afters. And when I do presentations, I always show before and after scans. And you'll see once they go through treatment or they find ways to calm that limbic system, improve GABA, and sue like everyone probably has to do by listening to this podcast, because they're probably all worked up like, oh my God. Then the healing starts and it goes great, but you really have trouble healing when your body is in that response. And another thing to note that I think is pretty awesome when I found this out, because I'm such a nerd, is that the mast cells that we always talk about, mast cell activation, and how people, I've been on your podcast, talk about the sensitivities and how mast cells degranulate and break down and cause all types of other issues. Well, yes, they're located, those mast cells, everywhere, but a large abundance of them are located in the limbic system, especially near the basal ganglia. So when I'm looking at that scan, I'm like, yeah, this might be something I need to think about with that patient.
Question on that though. So if people are interested in this and they can't travel to you, and I'm sorry, can you just refresh us? Where are you located again in your office?
So my clinic is outside of Washington, D.C. I'm in Reston, Virginia, near Dulles Airport.
God, now if somebody wants to work with you, I guess a couple of questions. Will you work remotely or virtually? And if not, is this a scan that people can do more locally or regional and work with a local doctor to do? Because I feel like there's so much value here. And we've heard this time and time again from people. SPECT scans are where it's at to get real information and real data to make informed decisions. But I think it's really hard to get them, correct?
No, it's not, because, they have this preconceived notion, oh my God, SPECT scans are X amount. But so for example, for me, I'm licensed in over 12 states around the country. And that's because our AMIN clinics, we're national. So we have clinics in Austin, Dallas, we have them 3 in California, we have Seattle, Chicago, Atlanta, New York. We also have Florida, and then Virginia, and we're expanding all the time, and just opened Arizona. So patients who I might see, you can see me without having brain imaging, right? Because I'm still a clinician at heart. But let's say you're listening to this and you say to yourself, I want to see what my brain looks like. You would just call our AMIN clinics and say, hey, I want to have a brain scan, but it's more what we call a functional medicine appointment versus just a psychiatric appointment, so you can have your brain scan and focus on chronic infections, which is a total different paradigm and cost. Or if you're really ill and you want to get that 2-week intensive, like hardcore, I'm going to get my testing, I'm going to find out vectors, if I have mold, if I have Lyme, or whatever might be plaguing you, and you want to just commit a 2-week vacation for your brain, then you can get the SPECT scan imaging, and you can do the 2-week program, our intensive program, where I treat you twice a week. You see your nurse, you get your infusions. It's like a residential program. But telehealth is available. Like I said, I'm nationally licensed. And we also have several clinics around the country. So people typically, if they can't travel, they will get it whatever the local or closest clinic is. And then I would serve as their consultation, and I would apply it to their chronic toxicities or infections. And I think it's just a really good way to see what level, because it's all about neuroinflammation. I mean, we can't look at neuroinflammation sometimes without looking at the brain. So how inflamed the brain is, but more importantly, to rule out other bad things outside of chronic infections and toxicity that can be going on. And I think that's the key.
So speaking of all these toxins, I want to tie something back together, because Jenny and I, we did an interview and we talked about mold and how mold can cause all these neuropsychiatric conditions, as you just spoke about, Dr. Cornish, right? So some of them, different species, can cause things like OCD, obsessive compulsive disorder, or depression, or sadness, or anger. Or, we heard a story about somebody, there was this homicide house where it caused aggression, right?
Mm-hmm.
I mean, it's really crazy stuff. So can you talk to us about what you found in correlating different types of mycotoxins in your patients, and what emotions those correlate to, or extreme emotions, right? Because I think that can help also from the standpoint of trying to evaluate, like, hey, I think I might be around mold, but like, what is it, right? And I think that's a really cool topic that's emerging, and how, there's all these species, but they impact us all differently, right?
And, that's so important, because even when you're looking at the term mental health, you have to look at kind of root cause of illness as it relates to mental health. And mold, you cannot ignore that. All right. There are so many studies that are shown, and I'm just proud of one I'm going to throw out there from my alma mater, Brown. I graduated from Brown University, and we did a study. Well, I didn't, but we, as the school, they did a study where they looked at people who are in water damaged buildings and had higher rates of depression versus those that were in controlled environments. And that's key. Like if you're in a environment and you may not know it's affecting your mood, and you move out of that environment and your mood also gets better, it's very important. And I ask patients that all the time. I never forget my favorite patient. She had several different mold toxins in her body. And she told me, oh, I divorced my husband. I'm feeling great. I was like, no, you moved from that moldy house. That's why you're off all your antidepressants. It had nothing to do with your spouse, because it's so true. It can cause, I've seen things like bipolar. I've seen mold toxicity worsen some of the symptoms of my autistic patients. I've seen mold cause dementia-like or Alzheimer's-like presentations and even misdiagnoses. Psychosis is very commonly found in my patient population, as well as attention deficit disorder and depression and anxiety. So it is one of those things you have to think about, especially when you're thinking about getting to the root cause of someone's mood changes, is the way I like to put it.
It's my turn to jump in. Since we're on the topic of, biotoxins that, can cause mental health issues. So we know Borrelia can do it. We know mold can cause a range of mental health issues. But a lot of times there's not a lot of information about what the co-infections do to the brain and the nervous system in terms of, impacting mental health. Can you speak a little bit about what you're seeing and how the co-infections might play into that as well?
Yeah. So with babesiosis, I typically find that my patients have this unrelenting anxiety, and they're being thrown all these, medications to treat anxiety, and it goes anywhere from panic attacks, social anxiety, to just unresolved anxiety, and they just fail all their medications. So that's the one I see most commonly with babesiosis. And I've also seen a lot of bipolar, that mania piece associated with babesia. And Bartonella is similar to what I see with Borrelia. I see a lot of depression as well as anxiety and focus problems. Now, to add a little cherry on top, it's not necessarily a co-infection, but it's one of the most common infections that I treat. And I also found in research that it is transmitted by ticks and other vectors, is toxoplasmosis. And toxoplasmosis is the most common parasite out there that's transmitted by cat litter boxes, pigs, cows, etc. But it go misdiagnosed. And these patients present with schizophrenia-like features. And I've seen that quite a few times here at my clinic, where patients are presenting with schizoaffective disorder, schizophrenia, and then you do your due diligence and you find out, aha, toxoplasmosis was a culprit. So you have to treat that parasite differently. And even with a lot of my Lyme patients, they may have just, standard symptoms that aren't getting better. And then I test them for toxoplasmosis, and that's a key missing piece. So when you're thinking about, the mental health component, and you definitely have, mania or schizophrenia involved, you gotta put that little nugget of toxoplasmosis in your testing.
That's really good information. Very, very helpful. Like I said, Borrelia often gets takes the prize for the cause, but sounds like it can be any number of things.
I used to think it was Borrelia until I kind of came over full time with Amen clinics, because I would see so many of their cases and they would send all these SPECT scans as consults in my other practices. And I was like, okay, yeah, Borrelia. But then when I started getting really full into it, it was so many more babesia patients. And especially with that anxiety, I was just like blown away. right? And the tricky thing with babesiosis, the tick-borne parasite, is that sometimes their treatments, like the anti-malarial medications, can impact the mood too. So I always find I have to be careful in assessing their mood very carefully and constantly while they're on medications like a atovaquone, and the like, because in Artemisia herbals, that can affect the mood simultaneously and already having this infection that does the same thing.
I feel like if we didn't ask you about methylene blue, we would have a big miss today. So we have to talk about methylene blue. I know that is one of your areas of expertise. Matt and I are big fans. Can you tell us a little bit about what how you're using it and what results you're seeing with it? And maybe a little bit about what it is for those who aren't familiar with it.
So methylene blue is magical blue dye. I mean, it really behaves that way. It really is a blue dye. And I first got exposed to methylene blue because it was in a component of what's called Urabel that I would use to treat a lot of my female patients who had interstitial cystitis or recurrent UTIs. But then the literature came out years ago that showed how methylene blue, this dye, right, not antimicrobial yet, but just a dye, in conjunction with other antibiotics, had a significant impact on the treatment of resistant Bartonella, which I see so often in my patients. And I was like blown away by that. Then they came up with another paper that said, oh, just kidding, not just Bartonella, but now we can do it with other agents that are natural too and treat, Borrelia biofilm. And I was like, whoa. Then they came out with literature on Alzheimer's and dementia and neuroplasticity and cognitive impairment. And now in FLCCC protocols, who are the doctors on the front line for COVID-19 management, they're using it as a second line recommendations for viruses. Okay. So that's what I mean about magical, because it has antimicrobial properties. It helps with those women who have that terrible interstitial cystitis. It also helps with the cognition and brain fog. All right. Even with dementia and persistent Bartonella and Borrelia. Now, you got to be careful though, because methylene blue is contraindicated with a ton of medications, especially those medications that you use for mood, this like SSRIs and among others. And you also have to be careful because there could be genetic mutations, G6PD, that it's contraindicated and you can do a lot of harm with trying to take this, okay? So it's not recommended to take without having previous labs and being under close observation with a provider, because just like everything, it can have its negative side effects. But I am seeing benefits in my patients with Bartonella and chronic tick-borne diseases, even the people who have neuropsychiatric manifestations of Lyme, because it does have some mood benefits. Brain fog, I'm using it a lot in my patients who have long COVID or Epstein-Barr, chronic fatigue and brain fog associated with those illnesses. And my patients who have, been diagnosed with dementia, I might use methylene blue with things like NAD together to help with brain and brain inflammation and cognition. So I use it anywhere from 25 milligrams. I've gone as high as IV methylene blue in some cases. And if people don't have contraindications, they do pretty well with it. It's one of my favorites. It's one of my favorite agents in my practice, in my toolbox, but I have to use it very cautiously. And now, people are just trying to use it on their own. And I'm like, that's dangerous. And I can't stress that enough to the listeners, that if something like that is what you want to use, you need to have help with that. You need to be guided because, like I said, those side effects can be serious if it's contraindicated for you.
So it is available over the counter. Is that a mistake?
Yes, yes. I think it's an absolute mistake for the reasons I mentioned earlier. I mean, it can be lethal side effects, like serotonin syndrome can happen if you're on antidepressants, or if you have that genetic mutation, G6PD, you can have a severe disease that can send you to the ER. So I would use caution unless you're working with a doctor to get that screening test. And also because it's so many medications that it can have a negative interaction with, you have to be careful, you know. And I saw that it was just being sold everywhere, and I had patients bring, I was like, wait, no. You need to be careful with this. And people don't mention that enough. We talk about the benefits because it is a great agent with a doctor, and a doctor who really understands how to use it.
Yeah, I, for one, did not know that it had so many contraindications with medication. So that's news to me. Wow. Yeah, I can see how it's definitely in everyone's best interest to use it with their healthcare professional.
Yes,
Yeah.
definitely. Get that screening. I mean, I see the side effects a lot because, like I said, I have patients who have tried a lot and people look for hope. And I always say, look, the best is yet to come, but find someone who can help you. Don't treat yourself because that's the worst thing you can do. And I'm a very spiritual doctor. You know, that's one thing about me. My patients know I pray. They know I'm hopeful. They know I'm going to get them through it. I'm going to have their back. But what I'm not going to support is just doing things like just because you heard about it or you saw it on TV or Instagram or published. You need help. You got to have that guidance.
What is the screening test for that, and how would somebody get that?
So it's as simple as doing a marker. It's called G6PD, and that's a genetic screening. Okay. So it's something you can do LabCorp Quest, any standard lab. You can ask your doctors for it. And then there's a long list of medications. Now, I tend to prefer the compounded form of methylene blue because even with the over-the-counter forms, it's so hard to correlate the actual milligrams to what we know as therapeutic dosing for those conditions we mentioned earlier. It's kind of like guessing at people who might get it online and put it in gel. I mean, you don't know how much you're getting. Versus if you work with a really good compounding pharmacist, and the one I use all the time, I use InfuServe, and they'll sit down with patients and they'll say, what's your meds you're on? And they'll go through those interactions with that patient's medication list. And that's key, fortunately, I haven't seen any negative outcomes with methylene blue, but I have heard some horror stories out there.
And last question about methylene blue, would you use it on its own or would you use it in conjunction with other treatments?
So I've used it on its own, like I said earlier, for interstitial cystitis. Some of my patients because I see a lot of women who have bladder issues and it may be unrelated to vector-borne diseases. When I'm using it for vector-borne diseases, I'm always using it in conjunction with something else. If it's antibiotics, it might be methylene blue with rifampin or methylene blue with zithromax. I might use methylene blue in conjunction with clotrimazole because that was one of the earlier papers that Bartonella and clotrimazole is an antifungal. I'll use methylene blue and NAD together simultaneously. I have some patients who have been treated for long COVID, and we might use methylene blue in conjunction with ivermectin for those cases. So I rarely use it as a standalone, and it's always, combined if I'm treating underlying infections.
Matt, I think Matt wants to jump in.
Yes, I have so many questions here and I'm patiently waiting. Thank you, Jenny, for letting me jump in. So, we've touched on this, and especially from a brain specialist like yourself, Dr. Cornish. I mean, first of all, you are way more than a brain specialist. You are way more than a Lyme doctor. I mean, you are the real deal. I don't know how else to describe it. I mean, there's so many questions I have for you that my brain is just swimming right now with questions. But one of them that is really sad to talk about is Lyme and neurodegenerative diseases like Alzheimer's and dementia and all kinds of things like that. I mean, especially Lewy body dementia with Dr. Alan McDonald and all the proof he's found. And I mean, I know somebody who has had late stage Lyme her whole life. Her mom, in New Jersey, I'm in New York, she's in New Jersey. And, I believe her mom now got diagnosed with Lewy body dementia. And I'm like, test her for Lyme. There are things you can do. Don't let it progress. Because we've heard from Dr. McDonald and so many others about what we can do here. But from the standpoint of correlating Lyme and all of these things with neurodegenerative diseases, can you speak to how and why chronic Lyme disease can cause these things? And then what testing, specifically your scans and other tests we can do to make that connection, and then how ultimately we can address it? Because I believe there is a point at which we can start to unravel this and potentially reverse it the more we understand it.
So, really great question. So let's break it down. So when it comes to these neurodegenerative diseases, few things happens. Number one, neurodegenerative, just break it down, simply means your nerves break down. Okay, they break down. And that happens with ALS, that happens with multiple sclerosis, which is demyelinating diseases. They happens, like you alluded to earlier, dementia, Parkinsonian features. It's just a breakdown of the nervous system. Now, we know that especially Borrelia burgdorferi, Borrelia burgdorferi, start there because that's what we know about the most with the research that you mentioned by dear Alan McDonald, how it crosses into the blood-brain barrier, okay? And they've actually seen this cultured in the human host, the spirochete. But we also know that there's something called intra-erythrocytic. So what that means is these bugs live inside your red blood cells, especially Bartonella and babesiosis. And what area in the body has the majority of the red blood cells? Your brain and your gut, okay? So when you're thinking about neurological and neurodegenerative diseases, ask yourself, why wouldn't an organism that lives in your red blood cells potentially have a negative impact on nerve cells, okay, and break them down? And that's because of toxicity. That's because of just its ability to break down and kill the cells themselves. But then you take it a step further and you can have autoimmune neurological diseases, all right? And that's something called PANS, or we also see in adults, which is an autoimmune neuropsychiatric syndrome associated with kids. They call it PANS. Or you can just have an autoimmune neuropsychiatric syndrome in general, and that can be caused by vector-borne diseases as well. And that's triggered when it gets even further, and it's called molecular mimicry. And I'll break that down for you. That means that this
Dr. Cornish, can I interrupt you? I apologize. I want to make sure I understand what you're saying so far. So the first part of this is the actual bug itself. I'll be very simple, right? The tick-borne illness or the bad thing, the pathogen actually goes into the brain and can cause damage and or death to brain cells, right?
Yep.
That's the first thing you said.
Yep.
The second thing you said was these neuroinflammatory things, especially that we see in children like PANS and PANDAS, which we hear more in the child community in Lyme disease. Those things create brain inflammation, causing neurodegenerative conditions and possibly psychiatric conditions as well. That's a separate bucket or separate categorization of how these conditions impact the brain. And now you're going into a third, correct?
Yep. And the third.
Sorry, I just wanted to make sure I understood it. Apologies.
You're following. You're with it. Sorry, I got a little excited there.
You're good. I love it.
I was like on a blow. This was
Let's do it.
Love. But then it's also, something called molecular mimicry, where that infection can integrate itself into your cells and your neurons too, make them look foreign. And so your immune system fights it as well. So then you have like autoimmune problems in the brain. So that's where it becomes tricky. And that's usually seen in late stage Lyme. So you have the death, you have, the autoimmune phenomenon that causes cellular death, and then you have the pathogen itself that causes the death of the neurons and that neurodegenerative presentation.
We've had so many doctors, ILADS, Lyme literate, and I've never heard somebody talk about molecular mimicry before. And the way you just described it. So essentially, the bacteria integrates with your own cells and tissues, and your immune system sees your own tissues and cells as being foreign, and then your immune system attacks itself. And that's the third categorization of neuroinflammation.
Yep.
I mean, that's crazy that these bacteria and viruses can do that. I mean, it's like advanced like alien tech, it seems like to me. It's just wild to even envision that. I mean, how do you deal with that? Like, how do you end up treating this molecular mimicry when your body's attacking itself? How do you unravel that as a doctor?
Well, here's the deal. You have to figure out why it's happening, not just what's causing it. And molecular mimicry can happen, that autoimmune process, yes, because of that trigger, but you also want to do things that calm down your immune system. So I always take it back, Matt, to the basics. You got to calm down that gut, calm down that diet, start your detox programs, get your body to optimal wellness so that your immune system is kind of more calm. Okay, because when molecular mimicry, it's like a hair trigger. It's like being, the immune system is fighting everything known to man, your cells, your tissues. You're getting Lyme, rheumatoid arthritis, autoimmune. It's just fighting everything that walks this path because your cells are looking for it. I also use things like SPM, which are like special pro-resolvents that help calm your immune system down. I use things like low-dose naltrexone that also is immunomodulating. But more importantly, I look at the body, rebuilding someone from the ground up, because that is how we're kind of really going to calm and get that immune system a little more in line, in check. So it knows that, hey, you need to go and fight these bad actors only and not us. So that's what I do for the autoimmune piece and that molecular mimicry.
You mentioned this SPM. Now, I feel like Matt and I have heard just about everything, but today we're hearing a lot of things we haven't heard before, which is great. We love it. We love to learn more. Can you go back to what SPM is and sort of like, is it a prescription? Is it an over-the-counter type product, or what is that?
Okay, so SPMs, they stimulate your body's, they resolve inflammation, all right? It's called a specialized, pro-resolving mediator. And there are different brands out there, but basically it just assists with stopping that chronic inflammatory response. And that's exactly what it does. Decreases inflammation, and I love it. And I have all my patients, because it's a derivative of crustacean fish, so anchovies, etc. So if you have an allergy to fish, you can't take it. But when you can take it, it's one of the only agents that I've seen. I do a lot of testing on an inflammatory marker called C-reactive protein that is used cardiology and also just in chronic infections. It's one of the only agents that I've seen calm that, aggressively decrease that inflammatory burden. So I use it a lot. And Metagenics has a couple, and there are other companies that have like SPM Supreme, but it's just a great way to modulate the immune system. And I usually use it with things like curcumin or turmeric simultaneously, but it's the real deal. It's really great.
That's crazy. I mean, I think the key there is to modulate, not suppress, right? Because so many of us, I feel like, are like, you don't want to suppress your immune system because then the microbes will take over and you'll get even sicker. But then you also have an overactive immune system causing all this autoimmune, making you even sicker. So how do you balance that? It's all about balance, right? You don't want to suppress it too much. You don't want an overreactive. You want that middle ground, which is where the keyword modulation comes in. Exactly. And these SPMs are really regulating inflammation, which is really cool. And, I'm just a quick Google search of some AI here. They're from, they're producing omega-3 fatty acids, such as DHA, which we hear about in fish all the time, right? So that's really, really fascinating. I'm so glad, Jenny, thank you for asking that expansion question, because that was awesome to hear. So but bringing it back to the neurodegenerative stuff, right? With the Alzheimer's, dementia, all these things we hear about, do you believe that some of this is reversible? Do you think that there's a point of no return? And do you also think that some of these things are repairable with proper testing and with proper treatment?
So that's the beautiful thing about the nervous system. And I was a neuroscience major as well. So that kind of blew my mind, is that the neuroplasticity component is key, whereby once a nerve cell is damaged, it can heal. That's why if you put them, if you find out what that root cause is and you put them on the proper protocols to treat whatever might be causing that neuroinflammation, to lower that inflammatory burden, those nerves heal. However, the caveat is once there's actual neuronal cell death, you're not going to bring it back to life. Okay. So when it comes to neurodegenerating diseases, you want to focus on calming the inflammation and removing those insults that are damaging those neurons, and they can be restored. And there's numerous ways you can do it, both by treating the offending agent, but like things we were talking about earlier, and even phosphatidylcholine, things that can help keep those nerve cells intact, but before it gets too late. And that's another thing I like about the brain scans, is that I can see when that brain starts that healing process, right? Or if there are areas where I'm like, ooh, hopefully that can be restored, but it's going to take time. Or like in severe traumatic brain injury, you kind of see, there are certain areas that can be restored, and I'll point to patients, but there are certain areas that may not be restored. So that's the beautiful thing that everyone should understand by their brain. That brain can heal with the proper strategies. It takes everything, not just treating Lyme, that's not it. You got to keep the whole body treated. But then you don't want to wait until it's too late, because then it's at the point of no return. So we can't revive them. We can just heal those that are damaged.
That makes a lot of sense what you're saying. I'm a occupational therapist in a prior life, and my specialty was in traumatic brain injury and just a lot of other types of neuro patients, stroke and that kind of thing. And to see the beauty of the brain healing using different neuroplasticity techniques, and this was all pre like DNRS and those types of programs. It's like restoring the mind and the body connection using different therapeutic techniques. It never gets old. It is always awe-inspiring, just phenomenal to see that happen. But like you said, depending on the level of damage, there could be a limit to how far it, or what could be restored. But to be able to kind of see the imaging and pinpoint going, we can restore here and we can make some changes there. That's amazing. That's, like such a phenomenal tool that you have with scans that you can see and use for those purposes. Yeah. Matt, we should be offering continuing education credits for this podcast.
For real. This is like,
this is the best CE class I've taken in years.
And blending it all together. One thing that bothers me the most about our community sometimes is we have our camps, and we can recognize that sometimes we evolve and we learn new things, and that's okay, right? And one of those things that bothers me the most is when chronic Lyme was refuted for so long. And I get it, right? The Bonacci's of the world from Stony Brook, right here where I live, you become so defensive that chronic Lyme is real and Lyme persists. And we have it on our website. And, you as the secretary to the ILADS board, I mean, there's over 700 peer-reviewed scientific articles proving the persistence of Lyme disease and other tick-borne illnesses. And we have them all on our site. You have them all on your ILADS site. But that doesn't mean that what some of these people were saying isn't partially correct, right? Because a lot of these doctors were saying it's not a persistent infection, it's an autoimmune complex, or it's something else. And that autoimmune component is true, and you just talked about it, Dr. Cornish, but it'll trigger some people because they think, I have a real persistent bug in my body. Yes, you do, but you also have an autoimmune complex, which you describe beautifully as molecular mimicry, right? So many people come on this podcast, and this is where I want to blend it all together. And they talk about, I have lupus, I have all these things, a ton of other autoimmune conditions. And is it separate from Lyme? Is it from Lyme? Is it related? Is it not? So can you just speak to that? Because I know you do a ton of work in the autoimmune world as well, not just from the brain standpoint, from a whole body standpoint. What are your views towards autoimmunity and Lyme? Do you group autoimmunity as a symptom of tick-borne illness or sort of a separate condition that should be handled separately that isn't really a cause and effect relationship?
So anyone who walks in my door and they have autoimmune disease, my first question to them is, why do you have an autoimmune disease? And you should see the faces. They're like either going to like me or going to run out my door. Like, what is she talking about? I just told her I had autoimmune. What? Why? I don't know. And that's because autoimmune, your body attacking you, is not automatic. Your body is triggered by something, like we talked about, molecular mimicry. So autoimmune doesn't happen out of thin air. But here's the deal. Yes, you can have molecular mimicry from tick-borne diseases that causes this autoimmune phenomenon. I see it all the time. I have patients, everyone who comes in my office with chronic infections or just chronic illness in general, I do an autoimmune panel workup. And a lot of times I'll see, because Lyme is the great imitator, positive rheumatoid factor and rheumatoid arthritis that goes away, positive mixed connective tissue antibodies that go away with treatment. And it fluctuates. And you ask yourself, well, if it was really something you were born with, why would it go away? Not to say that every single autoimmune disease is due to Lyme or due to molecular mimicry, because some autoimmune diseases are definitely inherited and genetic. However, the people I see are usually adults or older kids who have been diagnosed with a later onset autoimmune disease. And another piece that we don't mention enough is the gut. How dysbiosis, and how many patients, when we take long-term antibiotics, we have damage to our gut lining, leaky gut, gut inflammation. Well, that also can trigger your autoimmune phenomenon, because it just means your immune system is stupid. If he goes haywire, it starts attacking other things. But there's definitely a trigger. And I definitely think there's a connection with Lyme disease and autoimmune diseases. Also chronic viruses like COVID, Epstein-Barr, gut conditions, and a ton of other infections that serve as a catalyst for this molecular mimicry and for this confusion that occurs in your immune system. So you always need to ask, if you've been diagnosed as an adult with an autoimmune condition, why?
And I feel like a lot of that is the component of maybe we were more susceptible or potentially to lean autoimmune, right? And then the Lyme and other things bring it out, whether it be in an epigenetic thing, right? Or whether it be whatever. It's something that gets expressed later in life, and it's something that can be manageable. So I look at it as a good thing, right? If you get an autoimmune disease later in life after a tick-borne illness, that means it's most likely reversible, versus if you were born with it, it's going to be harder to address. And that's, I think, the difference there, that, you're of the opinion, Dr. Cornish, I just want to confirm that some autoimmune conditions are more, genetic, kind of locked in, that you're kind of dealing with early on in life, versus brought on later, which might be more of an epigenetic or an environmental trigger. And those ones are easier to manage, because if you didn't have them earlier on, you can probably get rid of them again, right?
Yeah, and I wouldn't necessarily call it anything easy, right? But I
True.
think that we're able to manage them. And how many people probably listening have been diagnosed with adult onset thyroid problems, right? That's kind of the most common one I see in my office, is these uncontrolled thyroids, either hypo or hyperthyroid, that happen later in life. And then we do the workup. It could be triggered by chronic infections, or it can be triggered by their gluten problems, or it can be triggered by chronic Epstein-Barr. And like we said, those epigenetic problems. But I find a lot, and this is what's so rewarding, just using thyroid as an example, when I get some of those triggers in control, like if I get their Lyme disease burdened down, or, their immune system up and running, they don't need that thyroid support anymore. And I'll never forget the first time I saw that, my patient, I put her on a low dose of a natural thyroid medication. And then about 3 months later, she was hyperthyroid. I had been checking her thyroid and she was fine. All of a sudden she was hyperthyroid. And we were able to start weaning her off her antibiotics simultaneously because her infectious burden had started to decrease. And then her thyroid started to heal because it wasn't as much of an insult on her immune system. So that's the phenomenal part about it.
Fascinating. I'd love for you to just go a little bit deeper on our dumb immune systems, right? Because I think there's an important component here. Why are we getting so much sicker now than ever before? And there's so many factors. We talk about all of the man-made toxins and chemicals, the higher stress lifestyles, technology, more expectations, keeping up with the Joneses, et cetera, et cetera. But I also think there's a deeper component, which is, this modern world, we're not exposed to microbes as our ancestors were. And, this clean lifestyle and the overuse of antibiotics, I think, has significantly decreased the diversity of our microbiomes. And as a result, we're not equipped to handle illness in the way our ancestors used to be. And because of that, there are things we can do to counter that. But is that what you meant by, our immune systems are dumb and they need to get better at responding to things like autoimmune based reactions? And can you just give us more there?
Yeah, so basically what'll happen is you can have the immune system that's really overactive. And that's because we have these two responses, Th1 and Th2, T helper cell 1, T helper cell 2 immune responses that you need to be in balance. And one might get triggered for one way or another. But when they're not in alignment, that's when you have this overactive kind of immune system at play. And you're absolutely right that a key component of this is our microbiome. That's huge because a lot of those immune cells are directly stimulated by inflammation and toxins from our gut. All right. And I always break it down very simply. It's one U. We're talking about maybe one or two co-infections and thousands of good and bad bacteria in our microbiome. And they all have to live together harmoniously for us to have an optimal immune system. And so I always check gut testing and gut health for my patients because there are certain bacteria like bifidobacterium or small chain fatty acids like butyrate, which are in your gut, but they also help you battle infections because they modulate your immune system. So that's the key thing. Like you said earlier, modulating the immune system and balance, but you can't do that without looking at the microbiome. And the other part you mentioned is how we do have a lot of, our society is different. We're so sterile, hand sanitizer, etc. And I think the reason for that is because our microbiome is so compromised that we just don't have enough of that good bacteria. We don't have enough of that Akkermansia, that good stuff, that bifidobacterium, those things that keep us strong and keep our immune system up and keep our inflammation down. And as a result, whenever we are giving anything that feeds these bad guys, these bad bacteria, it's easy to crowd out the good stuff. It's like, hey, we have way more bad bacteria in our bodies and our gut than the good. And even when we're doing things like sanitation, we're wiping out both bad and good. We're a bacteria in our gut. Antibiotics, we're wiping out both bad and good bacteria in our gut. So even some other medications. So you have to have that optimal gut support in order for us to have optimal immune support. And they even show in literature, and just in my practice, babies who are C-section, they have a harder time battling allergies and sometimes even chronic infections due to, one, the nature of their microbiome, and two, because they're taken from mom into this sterile environment at birth. So it's just all about, the body is beautiful. It's all about harmony and balance.
So I want to circle back to your background and tie it to, leading Lyme research that came out in the last month, because, and I'm going to read off your webpage, as a Howard Hughes Medical Fellow, you conducted translational research at the National Human Genome Research Institute for the NIH, working under Francis Collins. And about a month ago, we put it to our social media. We did a post about scientists cracking Lyme disease's genetic code. And our researchers have successfully mapped the genomes of 47 different Lyme disease bacteria strains. And the feedback was wild. everybody's saying, what good is this going to do? Is it really going to help us? What a waste of research money. I want to get better. This won't help, blah, 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 right? So can you weigh in? What do you think? So what do you think about, with your unique background in genetics and this study that they did, that cracked the genetic code of Lyme, 47 strains? Is it really a waste of time? And, you can be kind, but also feel free to be super blunt if you want.
Well, I think it's still important to understand these pathogens, right? And maybe in my hope, when I read that study, that it will help down the road, at least with Borrelia, with us getting more genetically driven, kind of treatment options based on that genome, that maybe certain genes are more susceptible to X drug or X thing. That's kind of the vision, the hope that I really want from this research, is that we can use that data just like we're using the Human Genome Project, and we're finding out specific treatments for certain genetic SNP mutations. I hope that they will be able to do the same thing with the strains that they've determined, and the genes that they've located and transcribed. That's my hope. That's the only way I think it will really be helpful, is if it can help guide our therapeutic management.
Yeah, and I think it reminded me very much of Dr. Tim Haysted. And I think his research is going to go deeper than just what he was currently working on. But we had him on the podcast from Duke. He was telling us about his research, using technology and this like massive way to test all kinds of natural and man-made drugs against various bacteria, and how they were hopeful that they were finding something that can just completely obliterate Lyme in the body. But that's wonderful. What about everything else? I don't think any chronic Lyme patient is just suffering from Borrelia. But this is where other doctors we've had on the podcast have said, well, Matt, if you can knock down one microbe, you might give the immune system a fighting chance as well. But I just think it's not fair to think getting rid of one thing is going to make you magically better. And I think that's the concern we all share. So, look, we see it with SOT, and I think SOT has done wonders for so many people. But, we have some good friends in the Lyme community, Kelsey being one of them, who had great success with SOT. But then after 3 months, she was sick again, and she had to get an SOT for another strain, and then another strain. And then, now your other co-infection is acting up. Oh, but by the way, there's not an SOT for that yet. So now we can't help you with SOT, right? So I just feel like there's never that magic bullet. And that's my concern every time I hear something like this, right?
Yeah, and I agree. And because it's multifactorial. And none of us have all the answers. So if you ever go see a Lyme specialist, like, oh, I have it all, you go run away. They're lying to you. Get out their office right away. Because we're still figuring things out, and we're figuring things out on a daily basis. And I think the one thing that changed my practice tremendously is when I just took a step back to reevaluate how I was treating, when I was using only hardcore antibiotics. I wasn't really even doing herbals. I mean, this was, like I said, years ago. And I'm asking, well, why aren't these people getting better? What am I missing? And then when I started asking that question, well, what makes this person? I mean, Lyme's been around since the caveman. What makes this person so unique? And that's when it came down to me understanding the basics. Like, look, you got to look at the basics. Like I keep preaching, because that's going to give you an understanding of a person's baseline. And in so many patients I hear, oh yeah, when you don't feel good, you don't eat well. I get it. I'm not a hypocrite. I'm never telling anyone in my office, eat an ice cube diet all day, gluten-free, blah, blah, blah. I mean, I know things that are preferable, that you can treat your gut and your life and get the inflammation down, like autoimmune programs and, gluten, and we're making certain restrictions, but it's also about what you do incorporate. And Lyme and all these co-infections, people are struggling so much that it takes a toll on the entire body, as well as your spiritual side. So you need to stabilize every area of the body, because yes, you suffer from these things and they're awful and there are a lot of them. But if we're not putting like the basics and just putting the bricks to that house together, then you're going to suffer for much longer. And you want to stay in remission, and you want optimal healing. And that takes responsibility just from the patient as well as the provider. And it doesn't take 60, 70 pills to do that. You go one step at a time. And I have to work so hard with a lot of my patients, like you were saying earlier, even with that Lyme data, like, oh, it doesn't mean anything, it doesn't work. It's hard, having vector-borne disease or any illness where you're struggling for X amount of years and you're doing everything right to get better, been dismissed, been persecuted, it takes a spiritual and physical and mental journey. And that's why things like limbic system and fight or flight comes into play. But you gotta look at the person. There's no such thing in my mind as protocols. They're individually tailored to that person, because these diseases, even though they have common symptoms, they're still going to present differently in each person based on their other imbalances in their body at that time. So that's kind of that's the tip I would give everyone who's going through it. Find someone who can do an individualized, tailored treatment approach and look at the whole person. I tell myself I'm a specialist, but I'm also a generalist when it comes down to treating these complex illnesses.
So I have one final question I want to ask before, and I'm totally putting Jenny on the spot just for everybody. She has no idea I'm about to do this. I'm going to have Jenny ask the final question. So Jenny, while I'm asking this question, think about your final awesome question you're going to ask Dr. Cornish. But my follow-up is, and it's a personal question, because you talked about the nervous system and fight or flight again, Dr. Cornish. And I was in chronic fight or flight. I didn't realize how bad I was, but a lot of people around me knew, but I couldn't see it. I've made significant progress, but I really still struggle with it because, I'm working full time. I work in the tech field. It's a high stress job. There's excitement when you do new things. Then there's stress when something breaks. And then there's all kinds of stuff that life throws at you. And I really find it hard to balance my nervous system. And I'm constantly trying to improve in that area. I take adaptogens. I try to do, mindfulness. I try to, sometimes the intrusive thoughts will come in and that happens, right? And that triggers you and spirals you. What is some advice you can give me? I'll be honest, frankly, and everybody listening who I think struggles with these similar things. What are some brain tips you can give us from a nervous system standpoint, an intrusive thought standpoint, and just a calming standpoint to persevere despite stress? Because we're all going to have stress in our life. We can do our best to minimize it, but it's always going to be there. And as we get better, we're going to face even more challenges as we try to do more with our lives as we heal.
I think one thing is to accept that that's normal. Okay. If I meet a person who is going through complex chronic illnesses and not in a fight or flight, then, because of all the pressure, because of all the stress, because of what you're going through, it's okay. That's the first thing, is accepting it and knowing that, look at it not just as something negative, but also a strength of yours. The next step, there are a lot of non-oral things that I have patients where I collaborate with doctors, may that be psychiatrists, and they may recommend things like neurofeedback or biofeedback or something called EMDR. And those are not psychiatric meds or tools. They're just ways to help you rewire the brain, and things like the neural retraining syndrome. It's all about how we deal with those stressors. Now, some of the tools I personally use, when I'm in that like fight or flight mode at work, and being a mom of triplets, if I'm in that mode, that 911 emergency, I can't stop this, it can't calm down, I might use things like GABA or L-theanine. I found Primal Trust helpful for everyone. I even recommend that for family and friends all the time, because anything you can do that is organized and simple, because some people tell me all the time, I can't meditate because when I meditate, I'm stressful for not being able to shut my mind down. And that makes me hate meditating even more. But I think just having those toolboxes. So like I said, for my supplement toolbox, L-theanine is great. GABA is wonderful. Making sure I'm optimizing my sleep. And then one thing I learned from Dr. Amen, which I thought was fascinating, he always said you can have these automatic negative thoughts. And when they come to your mind, write them down. And when you write them down, read them and ask yourself, is this real? Do I have to accept this? Or can this change? And these are little steps. None of this is fancy. Those negative thoughts are true. And we all have them that go on all the time in our mind. But it's just making that determination, take a step back, maybe write it down and say, is this true? or can this change? And if it can, trying to figure out where to go next. So supplements are helpful. I've seen DNRS, biofeedback, neurofeedback, EMDR to deal with trauma. I've seen psychiatrists recommend them, and I recommend DNRS all the time. And then having that strategy to deal with those negative thoughts. And that's key. That's really, really key. It takes discipline, because it feels like I might have 90 pages of thoughts every day, right? But you really have to take that time, and it takes some practice to really say, is that real or not? Or can that change? Or do I have to accept that? And it makes a difference. I'm telling you, just try writing things down. Any negative thought, write it down, look at it. It's called an ant. That's what he calls them, ants. And say, can you change those?
Dr. Cornish, you have been an overwhelming wealth of information today. We are at the last question. Now, it's a simple question. I hope the answer is yes. But if it's not, then I hope the answer is soon. Okay? My last question for you is, have you had the opportunity to go back to Brown and share any of this knowledge with the students that are in medical school, either recently or, in the past few years? And if so, what's the response been like?
So I went 4 years ago, I did a podcast for some of the kids at my, well, not kids, but students at my residency. And they specifically reached out because of a webinar I did on neuropsychiatric mold. And that's when they told me about the research. And in that spiel, because, it's still, we have restrictions for IDSA and, CDC guidelines. So it wasn't like I was saying, okay, chronic Lyme exists, but I was able to tie in with mold, how it makes other illnesses work. And I mentioned, in my patient population of treating people with complex or vector-borne diseases, and was able to go into it and talk about what that meant and what those diseases were and how they can be persistent and, last much longer than treatment. So that was great. So that was kind of the only time I've had to do that. I always try to have kids or students shadow me if possible, just to learn this. I'm a training physician for our ILADS, where I serve as treasurer. So I train other docs who treat tick-borne disease around the country as a preceptor on how to treat. They'll shadow me and look at all these cases, and some of them get frightened, like, I don't know if I want to do this. But it's also a way to introduce new doctors into this field. So because doctors are still students as well, right? I'm a student, I'm still learning. So whatever I can do to help educate, I'm all about it. And that's why, doing things like social media is so fun, because then I'll get younger people at schools who might mention or send a message and ask more about certain conditions. So I try as much as I can.
Hey, Brown, pick up the phone. Have her back. Come on.
Well, Dr. Cornish, if I had to use one word to surmise this entire interview, it would just be wow. And I sincerely mean that, because we had so many of your colleagues and peers reach out when they saw on social media we were having you on, or people that I just speak to privately telling them we were having you on, that we were going to love you. And I'm like, don't do it, because when people tell me I'm going to love somebody, my expectations go really high, and then I walk away disappointed. Because we've had almost 400 people on this podcast, right? Or 500 people on this podcast, I should say. But despite all that, I am still walking away feeling blown away by you and your intelligence, the hope you've provided to the community. And the most important thing I want to share is your ability to explain complex topics in such a simple and clear way and make them seem less scary in such a scary disease, right? I mean, I'm walking away filled with hope and joy, and which is so weird to say because it's just such a horrible thing. So you have made my night. I know Jenny feels the same way, and we just can't thank you enough for taking time out of your busy day to help our listeners on the Tick Bootcamp podcast.
Well, I am so honored to be here, and I thank you so much for those words. It means a lot. And, my biggest thing is suffering people. Like, When I got into medicine, that's all I wanted to do was help the suffering. And I mean that. And my patients know, I mean, that's at the truth. And that's the truth. I'm passionate about helping people get better no matter what they're suffering from. So anytime I'm asked to speak, I like to say, speak my truth and share my knowledge. And I'm so happy we did this format, because I was telling Jenny, this is a great format for me, because I get to go and talk about so many different topics, but they're all important. And the one thing I want to lead the listeners with, and you guys as well, is know that the best is yet to come. You may feel a certain way today, but that's not your new normal. And if you keep that faith and you keep working on that goal and you keep trying your best, even when you have those dark days or those negative thoughts, they're going to be brighter ones. And if you have those bright ones, hold on to them, because you're going to see them again. This is not a death sentence. This is a survivor sentence. And if you focus on their survival, the best is yet to come.